In one bite, this mosquito could deliver a virus that feels like lightning in your joints. Chikungunya virus, known as CHIKV, is an RNA alpha virus spread by Aedes mosquitoes. Since it first appeared in Tanzania in 1952, it's swept across the globe, from the Indian Ocean in 2004 to the Americas in 2013, Italy in 2007, and most recently, Foshan, China, in 2025. The name, it means to walk bent over, exactly what people do when that intense joint pain strikes. So how do we even find this virus in the first place? Let me walk you through the modern arsenal. RT-qPCR is our gold standard. It can spot viral RNA just days after infection. But what if you're far from a fancy lab? RT-LAMP steps in, using a simple heat block to get the job done, making it perfect for field diagnostics. There's also TRFIA with peptide aptamer B2. This new ultra-sensitive test can pick out the E2 protein at just 8.5 nanograms per milliliter, even distinguishing CHIKV from dengue in a urine sample. And for low-resource areas, recombinant antigen ELISA is making consistent, safe, and scalable testing more accessible than ever. Let's zoom in on the virus itself. Picture a sphere. Its outer shell is covered in E1 and E2 glycoproteins. These aren't just decorations. They're the exact targets our newest vaccines and tests are engineered to attack. Now what happens if you get chikungunya? There's no antiviral drug yet, so treatment is all about easing your pain. Think acetaminophen, and after ruling out dengue, sometimes NSAIDs, but that's just half the battle. Stopping the mosquito vector is crucial. That means old-school tactics like repellent, window screens, and tipping out water containers. Cutting edge? The release of Wolbachia-infected mosquitoes, which block the virus from multiplying in the first place. People always ask, how do I tell chikungunya apart from dengue or Zika? Here's the quick rundown. Chikungunya hits you with high fever and brutal joint pain, rarely any bleeding. Dengue can bring fever, bleeding, and even shock. Zika tends to be milder, but is notorious for causing birth defects during pregnancy. These symptoms can overlap, so joint pain that makes you hobble, that's the chikungunya giveaway. Thankfully, new multiplex PCR panels can test for all three viruses in a single tube, absolutely vital in places where these viruses circulate together. Let me give you a snapshot of the latest outbreaks. In late 2024, Senegal recorded 300 cases of the West African genotype. Within weeks, 12 infected travelers set off a cluster in southern France. Fast forward to July 2025. Foshan, China sees an outbreak traced to the ECSA Central African clade. The city's response? 7-day vector control rings around every confirmed case. But there's hope on the horizon. In labs right now, a single-dose recombinant AAV vaccine has already given mice full protection. Human trials are on deck, aiming for lasting immunity without repeat shots. Until those vaccines are ready, it's up to all of us. Accurate diagnosis, vigilant mosquito control, and smart travel decisions are our best defense. Thanks for watching. Don't forget to like and subscribe.